King Charles will meet cancer patients to show the illness doesn't have to be scary in his first public engagement since his own diagnosis. The monarch will return to royal duties on Tuesday with the blessing of his doctors by visiting a cancer treatment center with his wife Queen Camilla. The couple are expected to meet with patients and their families in a poignant show of support given the King's own cancer battle as well as that of his daughter-in-law, the Princess of Wales. A source told the Sunday Telegraph the King is keen to demonstrate how people can go on living a full life during treatment, not just after it, while also highlighting that cancer doesn't just affect those with the disease but all those around them. They added, "Cancer can be a scary word, but it doesn't have to be a scary experience." Charles is not yet clear of the disease and is still undergoing treatment, but his medical team are understood to be pleased with the progress made so far and remain positive about his recovery. To mark the news, Buckingham Palace announced 2 milestone events, the first of many, and passed on thanks for all the good wishes the King has received. As well as his outing on Tuesday, the King will also host an incoming state visit by the Emperor and Empress of Japan in late June. The Daily Mail has already revealed that planning is underway for Charles to attend his birthday celebrations, Trooping the Colour, as well as Royal Ascot and the summer garden parties. A source told The Sun that the King wants to appear on his favorite horse for the big event on June 15. They claimed he is keen to lead from the front by donning his spurs and saddling up on his horse Noble for the ceremonial birthday parade. Friday's announcement was accompanied with a new portrait of Charles, 75, and Camilla, 76, looking happy and relaxed, taken earlier this month to mark the first anniversary of their coronation. In a statement, Buckingham Palace said yesterday, as the first anniversary of the coronation approaches, Their Majesties remain deeply grateful for the many kindnesses and good wishes they have received from around the world throughout the joys and challenges of the past year. Asked how the King was feeling, a spokesman replied that he was greatly encouraged to be resuming some public-facing duties and very grateful to his medical team for their continued care and expertise. The King's health crisis became public in January when it was announced that he was going into a private hospital for surgery on an enlarged prostate. He remained in the London clinic in Marylebone for 3 days. At the time it thought that the condition was not cancerous, but the following month it was revealed that subsequent tests had discovered the presence of the disease elsewhere in his body. Buckingham Palace has not revealed the nature of the cancer or what treatment the King is receiving to deal with it. Officials have stressed that treatment is ongoing, saying, His Majesty's treatment program will continue, but doctors are sufficiently pleased with the progress made so far that the King is now able to resume a number of public-facing duties. Forthcoming engagements will be adapted where necessary to minimize any risks to His Majesty's continued recovery. They are not able, at this stage, to specify how long treatment will continue. A spokesman added, "It is too early to say, but His Majesty's medical team are very encouraged by the progress made so far and remain positive about the King's continued recovery." They added that any public-facing engagements will be announced nearer the time in the usual way, and will remain subject to doctors' advice, and stressed that it would not be a full summer program. Officials are at pains to point out that the King has worked throughout his diagnosis and treatment, dealing with state papers, meeting the Prime Minister and other dignitaries, and even undertaking engagements with small numbers of people behind palace walls. The first sign that the future was looking more rosy came when Charles undertook a short public walkabout outside church at Windsor on Easter Sunday. But the monarch has been unable, until now, to undertake engagements involving large numbers of the public either inside or even outdoors. It is unclear yet whether he will be able to travel to Normandy in June for the major D-Day anniversary commemorations, or to Australia, New Zealand and Samoa as planned in October. But it is understood that the King is keen to, if his health allows. A spokesman added, "Planning continues for ways in which their Majesties may attend such summer and autumn engagements, though nothing can be confirmed or guaranteed at this stage." All future plans remain subject to doctors' advice nearer the time, with appropriate adaptations made where necessary to minimize any risks to His Majesty's continued recovery. His duties will include both indoors and outdoors engagements, designed to minimize any health risks to him, such as picking up a cold, while his health is compromised. The Mail understands that the King is also hopeful of undertaking investitures, the handing out of honors, in the coming weeks and months. Again, it is likely that the ceremonies will be adjusted to take account of his condition and ongoing treatment. The palace declined to comment on whether members of the wider royal family, including Harry and Meghan, were informed of his latest news in advance. Prime Minister Rishi Sunak said on X that the King's return to public duties was brilliant news to end the week.